I'm going to take you back to the beginning, the summer of 1981. The world was absolutely unprepared for what was about to happen. 5 young gay men in the west coast of America were noted to have a very unusual infection. By the time the report was published on the 5th of June 1981, 2 of those young men died. Over the next several months and up to the end of the year, there were 270 more reported cases of very unusual infections and tumours, predominantly in young gay men. This termed, the phrase of gay plague was coined in response to what appeared to be a new outbreak of an infection. But with that, fear ensued. These young men were dying of wasting, of what looked like brain tumours. They got strokes, they went blind. The fear was because we didn't know how it was transmitted. We didn't know who was going to get it next. And as such, there was a lot of, I suppose, discrimination that would eventually unfold. In 1980, I started in the School of Medicine in UCD. So by the end of that year, all of this was unfolding, and all of a sudden I was in the start of what was to be the HIV epidemic that unfolded over the next few decades and is still ongoing. I also came from a sheltered middle-class background, which was typical for those of us who went to UCD at the time. I was from Kerry, thought I was sophisticated until I came to Dublin, past Newlands Cross, and I was a culture. So 2 years later, in 1983, the cause of this new infection was found, and it was a human immunodeficiency virus. So essentially what HIV is, it's a chronic viral infection that attacks certain parts of the immune system. And what ensues is AIDS, which is acquired immunodeficiency syndrome, which is a long list of infections and tumours that are caused by the weakened immune system. And this is exactly what was happening. I still remember the lecture I got from Professor Hillary, who was our Professor of Medical Microbiology here. It covered an A4 sheet of paper in 1983. And all I can still remember is the 4 H's. What were the 4 H's? They were the groups who were prone to getting the infection. There were hemophiliacs, homosexuals, Haitians, and heroin users. Now, this was a time in Ireland where homosexuality was illegal. Contraception was not widely available or barely available at all, and sex certainly wasn't spoken about. So society, not only in Ireland, but worldwide, took the higher moral ground and felt that, well, because of lifestyle choices, these people got the infection, and that's exactly what they deserved. So what ensued was that society pointed fingers. It shunned people to the point that people who were infected were afraid to tell anybody else that they were infected, because not only would they be targeted, but their friends and families may also have had recriminations from this infection. At that point, what happened was probably good in that celebrities started succumbing to the infection. Some of you are old enough in the audience to know some of them. Rock Hudson, Liberace, Arthur Ashe, who was a famous tennis player, Rudolf Nureyev, a ballerina, and our own Vincent Hanley. Now, Vincent, for those of you who are young enough not to remember, had it all. He was a Clonmel boy who was big and got bigger in the Big Apple, where he was a presenter on MTV. For those of us who remember, every Sunday afternoon we would watch the video series on RTE1 or 2. And before our eyes, Vincent wasted away, and it ended up that he had AIDS and died at the age of 33. What celebrity status brought to the infection is our ability to speak about it, and the ability of celebrities to actually fundraise for what was a disease that people didn't want to talk about, and that has been very successful. And it was probably the example of a disease that celebrity status made a huge difference in. Princess Diana went and shook hands and embraced AIDS patients in the mid-1980s. This hugely helped in not only the public's ability to contact or touch people with HIV and AIDS, but also for fellow healthcare professionals to do the same. But also what happened was activism, which really spawned from anger. The gay community were particularly angry at how they and those amongst them who suffered from AIDS were treated. So with activism and advocacy, they were hugely instrumental in driving policy at government level to ensure that there was research funded for this new infection, but also that there was treatment provided in as much as it was available in the 1980s, and that care was given for the patients. It wasn't until 1985 that a test was available, but you'd wonder with all that happened, why would you bother getting tested? There was no treatment, and if you were known to have it, you were absolutely shunned. So in 1986, I graduated from UCD, started my intern year, and that was the first time I had real contact with HIV patients. What happened at the time is that they were put in isolation. Their trays of food were slid under the door. The healthcare professionals, doctors and nurses, gowned up in spacesuits to go in to interact with the patients. So imagine if you were a patient in that room. No human touch from a healthcare profession, no human touch from anybody because you were in isolation, and everyone afraid to talk to you about it because, in effect, there was nothing we could do for you. So I suppose that inspired me to leave my comfort zone and decide to pursue a career in infectious diseases. It didn't exist in Ireland at the time. Of course, there were infectious diseases, but the specialty didn't exist. And I said, look, if I do what I want to do, I leave my comfort zone, I'll go abroad and do what I want so that when I wake up every morning, I'll do the specialty that I want. And that's exactly what I did. Left, like many others, in 1990, landed in St. Louis to the new world and to a new world of HIV and AIDS because the wards were full, the clinics were full of HIV and AIDS patients. It was still a dire infection. By 1994, the commonest cause of deaths in the US of people aged between 25 and 44 was HIV/AIDS. So that's saying something. So I ran the clinic there after I did my training, and unlike society that discriminated against those who were HIV infected, HIV didn't. It infected anybody. So I was treating the 17-year-old inner city poor pregnant girl and her mother, who was 34, who was also infected. I was treating the affluent accountant. I was treating the transgender beauty queen. They were all in the same clinic, all united by one infection, HIV. So there was very little hope at the time. And then in 1994, I was pregnant with my daughter Aisling. And I still remember the Wednesday morning when the first glimmer of hope was presented. And that was a trial, a clinical trial called ACTG 076. And this was when antiviral tablets were given to pregnant women in an attempt to prevent the infection going from the mother to the child. And they had to stop the trial prematurely because there was a significant drop in the rates of infection to the newborn babies from 25% to 8%, and it's much, much less at the time. And that rolled out into antenatal testing, which is now standard of care in HIV pregnant women. And after that, it became standard of care to use multiple antiviral treatments to treat HIV patients, because it was found that if you attack the virus in different steps of its life cycle, it was much more effective than just using one drug alone. And so in about 1997, it became standard of care to use combination of what we call highly active antiretroviral therapy. Thankfully, I got my job in Ireland at the same time because it was looked as if I had the cure and I brought it back in my suitcase from the States. That wasn't the case, it was just serendipity. So I started back in Cork. I won't say back in Cork. I started in Cork, walked in the door, had nothing, not even an office, but I did have 19 HIV patients awaiting me. They were delighted, I was delighted, and I had the Friday afternoon clinic, but brought in all my infectious diseases. It didn't matter if you had HIV or hepatitis or recovering from meningitis. Everyone got brought into the same clinic because to me it was just another infection. But what I did have to, other people didn't see it the same way. There was a yellow biohazard sticker stuck in the front of those with HIV. It took me 2 years to get rid of that, but I am an extremely persistent person, and it's gone. So several years later, we have now about 600 HIV infected people. We see them usually every 6 months because the treatments are so good. The lifespan with people who are lucky enough, as we are in Ireland, to have access to treatment is normal. So as chronic diseases go, it's one with a fantastic outlook. But the one thing that does happen, and when I do give the news to people that they're HIV positive, they're a bit devastated like anyone is with new disease. But the problem still is the stigma surrounding it. It's our response as society saying, oh, they must have done something like drugs or they must have slept around. And that's the one thing that needs to go. So I suppose looking at the title of my talk, HIV, the virus that made me a better doctor, it really wasn't the virus that made me a better doctor. It was the people who were infected with the virus who made me a better doctor. And what did they teach me? They taught me that being a doctor is not just about tests and tablets. It's about being compassionate, about being non-judgmental, about listening, about the healing touch, shaking their hands, and understanding that frequently they do this journey alone because of fear of stigma. They also taught me the importance of research, scientific research. 30 years ago, there was no hope with this infection. Even 20 years ago, no hope at all. And with proper investment in science and interested researchers, but also the advocacy that people and support groups had pushing that agenda, now leads to a chronic disease that is treated with 1 tablet a day. So yes, I have learned a lot from my patients, and I will continue to learn so that when the next new infectious disease comes along, I hope to have this better outlook. Thank you.